Health warning labels. Those visual labels cautioning us about the harms and health risks associated with tobacco use. They can be an effective smoking deterrent, like a billboard displaying important health-related facts, graphically conveying harmful realities, or perhaps important information that could help a person quit. But like any static billboard, health warning labels left unchanged have diminishing impact over time, disappearing into the scenery, changing from something we need to know to something we don't even notice.
For health warning labels to be impactful and relevant, periodic rotation is crucial. Rotation not only prevents wear out or consumer fatigue, it also enables a variety of messaging tailored to specific groups and responsive to current trends.
Researchers from the Institute for Global Tobacco Control conducted and analyzed in-depth interviews with stakeholders in 6 different countries, compiling valuable insights into health warning label rotation practices to understand practical challenges and address potential issues.
Hay una cosa muy burocrática en todo ese proceso de los pictogramas.
Encontrar las imágenes es algo muy difícil. We need to be able to speed up the process.
We learned about challenges specific to the rotation procedure, including resource constraints, legal loopholes, government processes, and the nuts and bolts of creating the labels themselves. We also heard about broader challenges tied to tobacco control implementation in general, such as tobacco industry interference and enforcement difficulties.
For the successful implementation of health warning label rotation, we found that it's simply unrealistic for every country to do all the necessary work entirely by themselves.
From this research, we've outlined clear recommendations that could have a substantial positive impact on health warning label rotation implementation moving forward.
A centralized image bank, centrally or regionally managed, and kept up to date with high quality, relevant images that have been properly evaluated would help ensure quality and accessibility while also addressing the biggest pain point the researchers observed. A centralized image bank would also allow countries to focus their efforts on streamlining their processes, minimizing dependency on political will and available resources, clarifying details around rotation frequency and number of variants, and working ahead to have multiple rounds of labels in the pipeline. Additional steps that can be taken include establishing strategic partnerships regionally or across state lines to delegate and streamline the process, focusing on enforcement, being flexible and responsive to timely issues and trends, and conducting evaluations during different stages of the process.
Taken both individually and collectively, acting upon these recommendations will help uphold health warning labels as a continuously effective tool in preventing and reducing tobacco use.